Okay, I am going to be performing a general assessment, a shift head to toe assessment. Before I do anything, I'm going to perform hand hygiene, put on gloves, and protect patient privacy. Okay, my name is Heather. I'm going to be performing a shift head to toe assessment and a general assessment. Do you mind verifying your name and date of birth?
Hannah Burns, 02/19/2003.
Okay, and do you have any allergies? Okay, and now I'm going to begin the assessment. So I'm just going to begin by inspecting her physical appearance, checking for color. Her color is appropriate for her race. Checking for, and her skin is like age appropriate for her age. You're 20, and she's in good hygiene. Her hair is clean. Her hair is clean. Her face appears clean. And her body structure and function are appropriate, and her body movements are so appropriate, and she seems to be in no distress. So, and she's answering my questions well and responding, so there appears to be no impairment in her mental status. So now we're going to move on to her vital signs. I'm going to first do her temperature. I don't have a temperature thing with me, a thermometer, but I'm just going to pretend. So I would have the patient lift up her tongue, put it under her tongue, and a normal would be around 98.6. And next I'm going to do heart rate. So I would use her radial pulse and do 30 seconds and count her heart rate. So a normal heart rate is between 60 to 100 beats per minute. And then respiratory rate, that's between 12 to 20. So I would also do the 30 seconds times 2, sorry. And then I would do the same thing with the respiratory rate. I would count her respirations for 30 seconds and then multiply that by 2. But if there is any abnormalities with her heart rate, then I would need to check her apical pulse. And then blood pressure. So I'm just going to grab my blood pressure cuff over here. I'm gonna put it around her arm and make sure that this is lining up. On her brachial artery right here. And I would pump it up. I would do her radial pulse and pump it until I don't feel her pulse anymore. But we already did that, so it's 120. So I'm gonna pump it up to 140. We're gonna pump it to 140, and then rub these. Okay. So here's one. Make sure that this thing is closed off. Okay, I'm going to 140, and then and listen to her brachial artery right here. So I'm going to pump it up one more time, and then listening for it. And listening for that first pulse, and then the very last one. Okay, so I hear the systolic at 122, and then the last beat at 61, which is her diastolic pressure. All right, next is O2 sat. So I would use a pulse oximeter for this, and her O2 sat normal would be 92 to 100, and the patient is on room air. So I would document if she was on a nasal cannula or any supplemental oxygen. Okay, and now we're going to move on. We're going to do her height and weight. So we're going to have you stand up, and I would use a height scale. And we're just going to say she's 5'3", and then her weight, she's going to stand on the scale. And the weight is 105. Okay. All right, now we're going to begin our head to toe assessment. So starting with the neuro, we're going to be looking at her hair, checking for any, like if there's any dry skin, and patient has been communicating with me the whole time, so she is AAO times 4, so, and following commands and everything, clear skin, clear, clear speech, sorry. And I'm checking her hair, okay, nothing's appearing in her hair. I'm gonna start with some, a pen light, using a pen light, I'm gonna check her pupil reaction to light. And just seeing it. Alright, pupils are perla, so and 3 millimeters and reactive, both equally bilaterally reactive to light. And now we're just gonna inspect the face. Just by looking, her face is symmetrical. We're gonna ask about her hearing. So can you hear me okay?
Mm-hmm.
Alright, and I'm just gonna listen to your ears. Alright, and there's no redness or swelling in the ears or behind the ears. And now, do you wear any glasses or contacts or anything? Okay. And so patient does not have any contacts or glasses. Now we're going to look into the nose. The nose is patent. Okay, nose is patent. Okay, and now we're gonna do her oral cavity. So we're just gonna look in her oral cavity. Okay, and her oral cavity is intact with no lesions or missing teeth. Now we're going to move to her cardiac portion. And so when in the general assessment, we already did the vital signs of blood pressure and heart rate, so we already got those out of the way. And now we're going to check the pulses of her radial pulses, and that is a +2, which is a normal finding. And now we're gonna do her pedal pulses. We're done with the pedal. And those are a +2, which is a normal finding as well. Okay, and now we're going to use we're gonna auscultate using the stethoscope her heart sounds. Starting with her apical, pulmonic, aortic. What did I say? Did I say aortic? Oh, I don't remember what I said. Okay. Oh, well, this is the aortic. And pulmonary, Erb's point, tricuspid, and mitral. Okay. And now listening to that, I could tell that there was no extra heart sounds, and S1 and S2 sounds were noted. All right, now we're gonna do her capillary refill. So we're just gonna take your fingers here and press down. All right, capillary refill is less than 3 seconds in all her fingers, and I do need to check for murmurs using the belt of my stethoscope. Okay, and no murmurs were indicated, so. Okay, now we're going to be moving on to the respiratory portion. We're going to move on to the respiratory portion, and we already did her respiratory vitals, so we already did respiratory rate, and she had a regular rhythm. So now we're just going to, I'm going to also take her lung sounds, which is 6. And her lateral, and her posterior side. Okay, there was normal lung expansion and no accessory muscle use. She's breathing. And like we spoke about earlier, she's not using any supplemental oxygen, so she's just on room air. And she doesn't have like no tubes or drains. Now we're gonna move on to her GI system. So I'm gonna have the patient lay down if you don't mind. And I would lift up her shirt, but for video purposes, I am not. And I would just be inspecting her abdomen, checking for symmetry or any lumps, checking for any visible abnormalities. And then I'm going to listen to her bowel sounds using auscultation. Starting with her right lower quadrant and moving counterclockwise. Okay, and now I'm going to be moving on to palpation. So I'm just going to palpate in the same, the bowel sounds were normal, by the way. Okay, now we're going to move on to light palpations, and we're going to move in the same direction. So let me know if you feel any pain or tenderness. No pain? Okay. And when was your last bowel movement? Today? Okay. Any constipation or diarrhea?
No.
Okay, that's good. Any nausea or vomiting?
No.
Okay. And she doesn't have a PEG tube or anything like that visible. So yeah, now we gonna move on to GU. So how do you self-void or
Yes.
self-voiding? Okay, so she's not using any Foley's or catheters or anything. And what color is your urine?
Normal. Yellow. Clear.
Yellow? Clear? Yellow and clear?
Yellow,
Wait,
yeah.
is it clear or yellow?
It's yellow.
It's yellow,
Yes. It's not cloudy, but it's yellow.
but it's clear. Okay.
And yes.
Okay, yeah.
Yes.
Okay, yellow and clear. All right. Now we're just going to be assessing her skin, looking for temperature, color, and any edema. So her skin is appropriate for her race. Her color, temperature is warm, and there's no visible edema. Just pressing down on the skin, checking for blanching. And patient does not appear to have any wounds or drains or anything. So no IVs. Now we're going to move on to musculoskeletal. How do you ambulate? Do you self-ambulatory? Do you
Yes.
walk on your own?
Yes.
Okay, so the patient is self-ambulatory. And now we're going to move on, if you don't mind squeezing my fingers for me. Okay. Her patient's hands are equal and strong bilaterally. And now I'm going to have you sit. Okay. Do you mind, sitting a little bit back? Can you push back on my feet? I'm just checking for her flexion and mobility and rotation and her strength and her pedal pulses. Push against and inward. All right, and push against. Out against me, towards you, and towards you. Okay, so patient's distal extremities are all have flexion and rotation. And I'm just going to check that for the arms. Push that against me, push towards me, against me, and towards you. I know it's a bit backward. And so all her distal extremities are have flexion and rotation, and they're equally strong bilaterally. So now we are going to move on to checking IVs. So we're going to check her IVs, if she has any in her legal case. No IVs are present, no midlines. And I think that completes our exam. So that's completed general assessment exam.